Sure. So the current treatment landscape for recurrent C. difficile infections is primarily the first-line standard of care for first-line or first episode C. diff is antibiotic treatment with either metronidazole, which has now been recommended against by the IDSA, or vancomycin. In some cases, fidaxomicin is indicated for more severe cases. That's relatively straightforward treatment. However, the challenge really for C. difficile is the recurrence after the initial treatment. After initial treatment, it's recommended to provide only vancomycin or fidaxomicin. In some cases, vancomycin taper. There is also a reference to the use of fecal transplant for multiple recurrent cases that aren't responding to the standard of care. However, the IDSA guidelines do note the strength of evidence needs improvement. And I think that's really because over the course of the last several years, we've seen an increasing report of fecal transplant as a useful preventative for recurrent C. difficile infections. However, there haven't been a lot of controlled clinical trials to really demonstrate the safety and the efficacy in a long-term fashion. So what we're doing at Rebiotix is developing a microbiota restoration therapy. One of those is known as RBX 2660. And what we really viewed in the field was that the current standards of care still leave patients with a conundrum of between 30 and 50% cases of multi-recurrent C. difficile will see another recurrence and another and another. And so there really is no approved treatment to address that population and to really get them out of that cycle of recurrence. And RBX 2660 is really directed at that.